Hi, Don here. Welcome to Podiatry Practice Mastery. I'm going to do a deep dive today into biopsies. And this is something that recently there was a master class that we did. And I want to teach and kind of go over some of the things that have helped me in private practice with doing biopsies. And that might be beneficial to you. So I'm going to teach you kind of the best techniques that have worked for me, how you can increase the number of biopsies, how to make it easier in your practice, how to kind of explain it to your patients, and kind of why to do biopsies. Really, why this matters to most of the people that are listening are because we want to avoid the litigation. And I think that's the reason for many times we go to these conferences and we might have to, let's say, a PICA talk on biopsies, or someone else is doing a talk on biopsies to prevent any litigation due to cancer and other things like that might see on the foot. But that's not the only benefit. I think the other benefit is to really find out what's going on in a lot of these skin problems that we see in our office. So let's first talk about biopsies. Okay, what are we going to use biopsies for? I want to keep it real simple. I'm going to start with talking about punch biopsies. I would say about 90% of the time I'm doing punch biopsies. If we have time, I'm going to go a little bit over, let's say maybe like a nail biopsy, which is the second most common thing that I do. So punch biopsies, to keep it real simple, the way I learned it, I do two 2 millimeter punch biopsies. The main reason I like to do two 2 millimeters is because I don't have to do a suture. Anything over 3, what I was taught is you have to use a suture, and it just slows down the whole process. I like the idea of getting 2 different parts of the same lesion, and it's simple. I put a little gauze and a little Band-Aid over it, and it makes it really easy to do. But even before we get into the type of biopsy, let's go into kind of the conversation we have with our patients. So our patients are coming into the office. They don't think that they're going to be getting a biopsy. It's not even on their radar. They just think they have a skin condition. They're not sure what it is, and they want you to tell them what it is. How many times have we had patients come into our office and they say, doctor, can't you just tell me that that's fungus just by looking at it? Well, a lot of times we can't. We can't just look at the skin. We can't just look at the nail and determine that it is a fungus. We have to take a sample, right? A lot of dermatologists, that's the way they do it. And many times when we're treating something, we think it's a fungus, let's say in the nail, and it comes back as maybe just something due to trauma or a bacterial infection or some other type of infection that can affect the nail or the skin. So the first premise is when a patient comes in, now what are the most common things that I'm doing biopsies for? I want to be clear, I'm not biopsying every wart that comes in. I am not biopsying every ulcer that comes in. What I normally do for it is I will take a skin sample if it's like a tinea pedis, or if it's something that I think is tinea, or if it's something that's an eczema, or something that just isn't getting better, that kind of looks different on the top of the skin, or on the skin, and I will do a biopsy. And when the patient comes in, they're not sure that they're going to get a biopsy. And so a lot of what's gotten better over time is my explanation. So when I see a patient, I'll say, Mrs. Jones, I'm not sure what that is. I have some good estimations, but I'm really not sure what it is or what's the best way to treat it. I can try things, but what I found that works the best is I can just take a little skin sample. Now, the word that I use for them is I say, I'm going to take a little skin sample. I don't say I'm going to take a biopsy, because when patients think of biopsy, they think of cancer. And I don't want to bring up that connotation. So I say, I'm just going to take a little skin sample today and see what's wrong. Okay. And usually they're okay with that. And so what I do then is I have these little buttons in my rooms where I call my staff and I just tell my staff I need a consent for doing a biopsy. And then I need 1 cc of Lido with epi. And that's all I ask for. And so my staff gets me the consent, the patient, and it's already pre-filled out. My staff has this consent paperwork, like any other consent that you're doing. Some offices don't even do consents. I do consent, and I just say, where I'm going to be doing a biopsy. And then I say, what are the risks? Well, risks could be slow healing, could be infection, things like that, typical things you would put in your consents.